Welcome to the Explainer. All right, let's talk about a topic that's pretty much guaranteed to show up on your exams, viral encephalitis. We're going to break this down, high-yield style, so you can lock it in and recall it easily when it really counts.
So here's the game plan. We'll start with a core distinction, then look at the viral culprits. After that, we'll cover the clinical picture, figure out how to crack the case with a diagnosis, and wrap up with the really high-yield treatments. Sound good? Let's get into it.
First things first, let's tackle a really common point of confusion, one that examiners absolutely love to throw at you: encephalitis versus encephalopathy.
Okay, so here's the main takeaway, and it's super simple. For encephalitis, I want you to think of the I. It stands for inflammation, usually from an infection. We're talking about the brain tissue, the parenchyma, actually being inflamed. Now, encephalopathy, that's way more general. It's just a broad term for brain dysfunction, which could be from anything like metabolic issues or toxins. So for your exams, remember, encephalitis is inflammation. That's the key.
All right, we've got the definition down. So, who are the actual troublemakers? Let's line up the usual viral suspects.
You can see we've grouped them into a few categories. The big ones you've absolutely got to know are the herpes viruses. Think HSV, CMV, and the Arboviruses, right? Those are the ones spread by things like mosquitoes. Then you have some others like Rabies, but honestly, for your exams, if you can nail down the herpes viruses and Arboviruses, you're in a really good spot.
Okay, get your highlighters out for this one. This is a classic exam question. If they give you a case of sporadic viral encephalitis, meaning a random, one-off case, what's the #1 cause? It's herpes simplex virus type 1, HSV1. Every single time, you have to know this. And here's the other side of that coin. What if the question talks about an epidemic, an outbreak, particularly in a place like India or elsewhere in Asia? Well, then your thinking has to shift immediately to Japanese encephalitis virus. So let's just recap that because it's so important. Sporadic case, think HSV1. Epidemic in Asia, think JE virus. Easy points right there.
So, what does this actually look like in a patient? Let's move on to the clinical picture. Recognizing these signs is absolutely critical, and I've got a great way to help you remember them.
Yeah, so what are the classic signs? I mean, the presentation can be all over the place, right? From just a fever and a headache to full-blown psychosis and coma. It can be confusing. That's why we need a solid mnemonic to keep it all straight, especially when you're under pressure. And here it is. Just remember that the patient is shaken. It's a perfect acronym. We've got S for seizures, H for hallucinations or psychosis, A is for altered consciousness. This can be anything from lethargy to a deep coma. K stands for cranial nerve deficits. Yeah, creative spelling, but it works. E is for extra movements, like those twitchy myoclonic jerks. And N is for neck rigidity, which you'll see if there's some meningeal irritation too. So just picture a patient who is literally shaken by the illness. It'll stick with you.
Okay, so you've seen the signs. You've used your shaken mnemonic, and you're thinking, this looks like encephalitis. So how do you prove it? Let's talk diagnosis.
The absolute cornerstone, the one test you have to do, is a lumbar puncture for CSF analysis. What you find in that spinal fluid is going to tell you so much. It gives you a classic profile that just screams viral infection in the central nervous system.
And to remember what you're looking for, I love this little memory trick. Just imagine, a lymphocyte and a protein walk into a bar, and the glucose is normal. What does that mean? It means you're going to see a high lymphocyte count, that's lymphocytic pleocytosis. You'll see a mildly elevated protein level, but, and this is the key differentiator, the glucose level will be normal. Why? Because bacteria gobble up glucose. So in bacterial meningitis, glucose would be low. In a viral case, it's normal. That's a huge clue.
Now, specifically for our #1 suspect in sporadic cases, HSV, that CSF profile is a great clue, but it's not the final answer. The definitive gold standard diagnosis comes from doing a PCR on the CSF. The PCR is what actually finds the viral DNA, and that's how you prove it's HSV.
All right, last section, and it might be the most important one. Let's talk treatment. This is where we can actually save lives and brain function, so it's obviously super high yield.
So, for a lot of these viruses, unfortunately, we don't have a magic bullet. The treatment is mostly supportive care. You manage the fever, you control any seizures, keep the patient hydrated, but there's one enormous exception. One situation where there is a specific treatment, and you have to know it. So let's say you've got that sporadic case. The patient is shaken. Everything in your gut is screaming herpes simplex encephalitis. You sent the CSF for PCR, but you know that's going to take time. You don't wait. You give IV acyclovir immediately.
This is a non-negotiable critical step. Every minute you wait, more brain tissue can be damaged. You absolutely have to treat on suspicion. Don't wait for the PCR result. Time is brain.
So, let's lock in the specifics. For HSV, it's IV acyclovir. And for the exams, you might even need to know the dose, 10 milligrams per kilogram every 8 hours. Now for CMV, which you tend to see more in immunocompromised patients, the drugs are different. You're looking at ganciclovir or foscarnet. Knowing which drug is for which virus is definitely fair game for a question.
Whew, okay, that was a lot. But hopefully it's all starting to click. Let's just do a super quick summary to pull all the key takeaways together.
Here's your 5-step plan for any question on this topic. It's your mental checklist. 1. Distinguish encephalitis from encephalopathy, inflammation versus dysfunction. 2. Suspect the right virus. Is it sporadic like HSV or an epidemic like JEV? 3. Recognize the signs using shaken. 4. Diagnose using those classic CSF findings: high lymphocytes, high protein, normal glucose. And 5, and this is the big one, act. If you suspect HSV, start IV acyclovir right away. If you can walk through those 5 steps, you can handle any question they throw at you.
And that's a wrap on our high-yield review of viral encephalitis. You've really got the core framework down now. But as we hinted, that big one, the king of epidemic encephalitis in Asia, well, that deserves its own deep dive. So in our next explainer, we're going to tackle Japanese encephalitis in detail. I'll see you then.